Welcome to the 8th presentation in our series on family involvement in dementia care. Changing care settings, also sometimes referred to as a transition of care, occurs when our loved one's condition and care needs change during the course of a chronic or acute illness. An example of a transition of care would be transferring a loved one from the hospital to a skilled living facility. This program builds on previous programs about talking with providers and the healthcare team openly and honestly, don't be shy, working to be clear yet polite, and talking with providers about medication use and treatments. These are all important skills to use when our loved one with dementia changes care settings. Changing healthcare settings can be extraordinarily stressful. Today, we'll talk about the skills needed to ease the stress and perhaps avoid unnecessary moves, like a hospitalization, during this change. As a reminder, this program is one part of our training series focused on creating a partnership approach to caregiving. This involves working as a team to assure your loved one with dementia receives the best possible care. You can apply this when your loved one changes care settings. Being a partner with your loved one's healthcare team relies on two-way communication to help reinforce and monitor the care transition plan. It also means asking questions or for explanations regarding the plan, bringing up concerns with the facility, transition, or planned treatments, and being prepared for this process. Before we get started, let's look at a few tips from family caregivers who have experienced a change in setting with their loved one. Discuss options, including personal, healthcare, and financial, early in the disease process, while your loved one can still express their ideas and wishes. Recognize the different levels of care provided by facilities. It is important for caregivers to know what kind of care is offered at each care setting and the specific reasons their loved one now needs a higher level of care. Make their new environment look more familiar, like the old one if possible. Bringing in pictures or a favorite blanket may help ease the transition. Know the name and phone number of a person to contact if a problem arises during the transfer. Regardless if the next care setting is a couple minutes or a couple hours away, it is helpful to have this information if assistance is needed or questions come up along the way. Lastly, caregivers can reach out to a facility ombudsman who can assist with an appeal of a transfer decision or work with the facility to come up with another solution, which may include keeping your loved one in their current environment. Transitional care is an approach to improve care for loved ones. This point in time is often very emotional for the person with dementia and their family. Transitional care offers a means to support the transition and make it less stressful for everyone involved. Transitional care refers to the process, coordination, and continuity of healthcare when a patient transfers between different healthcare locations or different levels of care within the same location. This is delivered by an interdisciplinary team focused on the caregiver and their loved one's needs, preferences, and goals. Continuity and communication are necessary for a successful transition in care. Today, we will be going over the guiding principles of transitional care when our loved ones change care settings. These principles include an updated and patient-centered care plan. A care plan is a document that provides a roadmap to guide all who are involved with a patient's care. This care plan should be patient-centered, meaning the care plan takes into consideration the values, experiences, and personal needs of you and your loved one. And since caregivers are part of the healthcare team, they should have input into their loved one's care plan. Active communication between facilities is necessary for timely and up-to-date information to be sent to the admitted facility. Care plans should arrive before you and your loved one do. Be proactive. the transition plan should start as early as possible in order to prepare you and your loved one for the next care setting. Let's review some common assumptions caregivers may have regarding the transition that may not necessarily be true. One assumption, for example, is that the primary care provider or other members of the healthcare team know your loved one is transitioning to a new healthcare setting. In reality, many times outside providers are not told that a change is being made to a patient's healthcare plan or next steps. Another is that all healthcare facilities share medical records. In many cases, physician clinics, hospitals, pharmacies, and nursing homes are not connected. Special requests may have to be made to share information between settings. And do not assume that all facilities provide the same level of care. For example, some assisted living facilities may offer medication services, but other assisted living facilities do not. Additionally, staff may have special training for the needs of patients living with dementia and their caregivers. Let's take a minute now for a discussion. If you have been through a transition in care, what barriers did you experience when a loved one was preparing to transfer to a healthcare facility or between facilities? What barriers did you experience when a loved one arrived at the facility? Finally, how did you overcome these barriers? Please pause the presentation now, and then, when you are ready to continue on, press play. To overcome some of these obstacles, here is a checklist of items that will be helpful to know before your loved one changes care settings. This model has been adapted in healthcare settings nationwide. It starts with scheduling follow-up appointments before transporting your loved one to the next care setting, so there is a clear plan of next steps or a routine visit if there is a need. Go over red flags or warning signs that may indicate the need for immediate care. Consider using a personal health record and know what medications were changed at discharge. Be familiar with the medications that are to be administered at the next healthcare setting. Let's talk a little more about each of these. Ideally, scheduling a follow-up appointment after the transition should be done before your loved one is transferred. Check with your care team to determine how soon your loved one should be seen by a provider. Coordinating and scheduling appointments may be assisted by a variety of team members, including social workers, nurses, pharmacists, and other providers. Be sure to include the new care settings team when scheduling appointments. Waiting until the last minute to schedule an appointment may result in delayed care if the provider's schedule cannot accommodate for a last-minute appointment. Also, consider transportation to and from these appointments. Will you be available to go to the appointment and provide transportation? Or will you need assistance from a provider, such as a wheelchair-accessible van? Will you need assistance from a direct care worker, such as home health, in case your loved one needs to use the restroom while at the appointment or needs help to transfer in and out of the vehicle? Make needed arrangements in advance to alleviate any last-minute obstacles. Next, we will talk about knowing what red flags to watch for at the new care setting. Red flags, or warning signs, are terms used to indicate that a condition is worsening and you may need to call a provider. However, some symptoms may be self-managed by a member of the immediate care team, including the caregiver. Talk with your care team about which red flags mean to seek help and which you can try and manage on your own. Develop an action plan that you will follow when warning signs appear and know who to call when the need arises. Some institutions may want to use an electronic personal health record to record red flags and what action steps you will take when you identify a problem. When thinking about a transitional care checklist, Another helpful piece of information is a personal health record. Let's talk a little more about what that is and what information should be included. A personal health record may help you and your care team organize and track your loved one's health information. This information can be kept in a notebook and is helpful for ensuring continuity of the care plan across providers and settings. Items in a personal health record may include care team contact information, red flags, allergies, health conditions, responses to treatments, such as certain treatments that worked or did not work, concerns and questions for the care team, and current medication list. Finally, the last component in our transitional care checklist is to be familiar with your loved one's medications. Medication changes frequently happen during the course of treatment. Oftentimes, patients are prescribed new medications or old medications are discontinued, making it difficult to keep up with the current medication regimen. Ask for the discharge medication list to be reviewed with you, along with any changes to expect at the next care setting. Also, ask for a copy of the medication list to take with you. When filling prescriptions, use only one pharmacy if possible to avoid confusion. For example, hospital staff often rely on community pharmacies to provide medication information, so they may reconcile medication lists at the hospital. Hospital staff may not know to contact multiple pharmacies for updated medication information, placing the patient at risk of receiving incorrect medications. Also, talk with a pharmacist regarding a medication administration system, such as a pill box. Keep an updated medication list with you at all times. This list could be kept within your loved one's care plan and updated as needed. This list should include all prescription and over-the-counter medications, as well as herbals. This includes tablets, inhalers, creams, drops, injections, patches, liquids, jellies, and ointments. Include the medication name, strength of medication, dosing instructions, such as take 1 tablet by mouth once daily, and, if possible, the prescribing provider. Note any medication allergies or any adverse reactions to a medication. Lastly, include the most recent date the list was updated. Now that we have talked about our checklist, we want to highlight a few community resources that can help with a loved one's transition from one care setting to another. Resources available in the community may provide services to help ease the transition of loved ones to new care settings. Some community pharmacies may reconcile medications during the transition and package medications using daily dosing packages or pill boxes and deliver them to the care facility. Aging services within the community may provide long-term care planning, legal services, transportation, and adult daycare, as well as a variety of other services. One example is an Aging and Disability Resource Center. Refer to a transitional care planner, nurse, or social worker who is helping to coordinate the transition for resources in your area. Let's take a few minutes for a breakout discussion. If you have been through a transition of care for a loved one, how did you prepare for that transition, and what was important to you during the process? Please pause the presentation now to allow for discussion, and then, when you are ready to continue on, press play. High-quality transitional care can greatly improve the transition between healthcare settings for you and your loved ones. The process relies on the following: active communication between healthcare settings, including providers, caregivers, and patients, to ensure the continuity of health information, preferences, and goals between settings. An updated and patient-centered care plan to help guide the transition. Proactively scheduling follow-up appointments, recognizing red flags, using a personal health record, and reconciling medications between settings.